Good morning, everyone. So, in the last class, we have discussed regarding what are these antigens, what are antibodies, and what is an antigen-antibody reaction, and what kind of cells are involved in the immunity. So, today in this class, we are going to discuss regarding MHC or HLA complex. So, MHC is nothing but major histocompatibility and transplantation antigens. So this is a topic that we are going to discuss in today's class. Okay. So what is MHC? MHC is major histocompatibility proteins and transplantation antigens. So what HLA means human leukocyte antigens. So as these were involved in the transplantation or rejection reactions and as these antigens or as these proteins are involved in identifying or differentiating one's own tissue from the other tissues. So as these are involved in histocompatibility, that means if the same kind of cells are present, then we call it as compatible. If it is different, then we call it as incompatible. So HLA antigens, they are capable of, they are involved in determining one's self antigens from the non-self antigens. So that is the reason these are called as human leukocyte antigens. And as these were involved in the compatibility kind of thing, so that is the reason they are called as major histocompatibility complex. Okay, so this because of this MHC proteins, there is a possibility of doing this transplantations. So did you hear that like kidney transplantation, liver transplantation? So sometimes there will be failure of this transplantation. Even after transplantation, that will be failed. So that we call it as transplantation rejection reactions. So when does it happen? Only when our body is not accepting as it as its own cells. So then it will be like incompatible. So how can this be done with the help of these proteins? That is MHC complex proteins. Okay. So and with these transplantation antigens, where are they located? They are located on chromosome 6 of any nucleated cells and of the body and also platelets. So on these platelets in our body, these MHC proteins or MHC antigens are present on the chromosome 6. Okay. And then on these chromosome 6, they are located on the loci of A, B, C, and D, and on the short PM of chromosome 6. So these are the locations of these MHC proteins. And as these are located in different parts or different locations, loci, so they'll be like highly polymorphic in nature. So this is a picture of HLA system on chromosome 6. So if you consider this as a chromosome 6, class 1 has HLA, B, C. Class 3, these are located over here, and class 3 are located here. This is the short P arm. P arms, these two are Q arms. So on the short P arm, these MHC proteins are located. Okay, and depending on the characteristics, again these MHC proteins were classified into 3 different classes. Okay, that is class 1 MHC, class 2 MHC, and class 3 MHC. MHC is nothing but major histocompatibility complex. On class 1, if you see in this picture, they are located at HLA A, B, and C. So as they are located on the sites like A, B, and C, so these are called as class 1, HLA A, HLA B, HLA C. So depending on their location, they were classified. And also CD8 plus or T suppressor cells, T lymphocytes, carry receptors for class 1 MHC. So the receptors for class 1 MHC is carried by CD8 plus cells. CD8 plus cells are also called as T suppressor cells, T suppressor lymphocytes. So these will carry these receptors for class 1 MHC proteins. So and these were used to identify class 1 antigens on them. So these whatever the T cells, T suppressor cells are there, they will be having receptors. So these will be useful in order to identify class 1 antigens. And coming to class 2 MHC antigens, they have only one single locus, that is D. So HLA D. Again, these were further classified into D subtypes like DR, DQ, and DP. So it has a single locus, that is D, and these will have further 3 loci. Again, that 3, it is subdivided into 3 types, that is DR, DQ, and DP. And it is identified by class 2 MHC is identified by B cells. That means the receptors for class 2 MHC are present on the B cells. So B cells are also called as CD4 plus. These are present on B cells and also on CD4 plus cells or T helper cells. So these will be able to recognize these class 2 MHC proteins. And then coming to class 3 MHC antigens. So these are components of the complement system like C2 and C4, which are coded on HLA complex but are not associated with HLA expression. So these are used for antigen identification. It does not have any loci. It has complement factors like C2 and C4, which are present on this HLA complex. Okay, so again I am repeating, class 1, class 2 and class 3 MHC, depending on their location or depending on their characters, they were divided into 3 different classes. So class 1, they are located on the loci like A, B and C. So that is the reason they were called as HLA-A, HLA-B and HLA-C. And then coming to, and so these have receptors for T suppressor cells. So the T suppressor cells or CD8 plus cells have these receptors. So that will identify this class 1 MHC antigens. And then class 2 MHC antigens, it has only one locate, that is D. So HLA-D, and it is further subdivided into 3 different types, that is DR, DQ, DP. So these were identified with the help of B cells and CD4 plus cells. CD4 plus cells are also called as T helper cells. And then coming to class 3 MHC, so they does not directly involved in these reactions, but they are associated with its expression. So for recognition, these are helpful. It contains complement factors like complement 2 and complement 4. These are present on this HLA complex. So this is all about MHC antigens. So every person will be having different MHC antigens. So depending on that MHC antigens, if it is compatible with other person's chromosomes complexes, then only they both will be like compatible. So if it is not, if they are different, then they will not be having any compatibility, and that will be rejected. And then MHC antigens present on the cell surface. So these were present on, as I said, these were present on the chromosome 6. And if it is present on this cell surface region, so what does it will do? It will help the macrophage in its function of bacterial recognition. It helps in the recognition of the bacteria and also helps in the presenting the foreign cells to T cells. So first it will help in the identification of or recognition of this bacteria, and also once they identifies or recognizes that they will take it and will submit to this T cells, that is CD4 plus or CD8 plus cells, or to B cells. As I said that if it is like MHC, if it is identified by MHC1, it will be presented to CD8 plus cells or T suppressor cells. If it is identified by if it contains like MHC2 antigens, identifies that bacteria, then that will be submitted by B cells or CD4 plus cells or T helper cells. So this is how these MHC antigens are present and on the cell surface, and what is their role. Their role is this. So then coming to detailed role of HLA complex, what is its main role? So first and foremost, the main role is organ transplantation. So as I said that they will be having a capability to identify its own cells from this, to differentiate its own cells from the other cells. So this is how these will be helpful in the organ transplantation. As I said that if there is a person or a patient who wants the transplantation or graft, that person will be considered as recipient. So this recipient's immune system, it can recognize histocompatibility antigens of the donor organ. So if the donor organ will be having some histocompatibility antigens, and whoever the recipient is there, who wants to receive that graft or any other organ, so he will be able to recognize the histocompatibility antigens which are present on the donor organ. So once if it recognizes, if the recipient recognizes that donor's his antigens, if the antigens of this donor and recipient are matched, then that organ will be compatible. So then it will accept it. If these are different, it will reject the graft. So that means there will be failure of this, organ failure will be there, even though transplantation has been done. So in this process, both humoral as well as cell-mediated immune response are involved. That means T cells and B cells both were involved in case of genetically identical transplants, non-identical transplants. And the second thing is regulation of the immune system. So as I said that these are present on the surface of the macrophages helps in identification of bacteria. So this is how they will helps in the regulation of immune system. Like class 1 MHC antigens regulate the function of cytotoxic T cells or CD8 plus subpopulation, and class 2 will regulate the function of helper T cells or CD4 plus subpopulation, and also along with the CD4 plus population it will also regulate the function of B cells. And then coming to third one, association of diseases with HLA. So because of this incompatibility, a few diseases comes. So it includes inflammatory diseases like ankylosing spondylitis and autoimmune disorders. Autoimmune disorders like when why autoimmune diseases comes here? Why? Because when our body identifies or thinks ourselves as also a foreign cells and starts attacking it, then we'll be getting these autoimmune disorders. Autoimmune disorders, that means our cells as are recognized as foreign particles and our body will be fighting against our own cells causing a disease. So that is all about autoimmune disorders. It includes like rheumatoid arthritis, insulin dependent diabetes mellitus, and inherited disorders of metabolism like idiopathic hemochromatosis. So these are the diseases which are associated with HLA, that is human leukocyte antigens. And coming to, as I said, that whatever the thing that we are transplanting from the donor to the recipient, that we call it as graft. Again, these grafts were defined or of 4 different types. First is autograft. Autograft, that means auto means self. So the donor and the recipient will be the same individual. That means if you see that if there is any major trauma, if there is a loss of large mass or tissue, at that time what will they do? They will cut a small piece from the thigh region which is bulky or from the back region and will transplant or will place it in the organ which has lost its tissue. So here in that condition, the tissue is taken from the same person who has to be received, like for whom we have to transplant. So that we call it as autograft. That means here this donor and the recipient will be the same individual. Okay. And then coming to isografts. So iso means similar, same. So isograft means the donor and the recipient will be of the same genotype. So the genotype will be same. And then allografts is nothing but they will be of same species but different genotype. Same species but different genotype is called as allograft. Xenograft, in which the donor is different species from that of the recipient. So here the species completely is different. That we call it as xenograft. Generally, xenografting will not be done. Only isografts or allografts will be taken, and autografts will be done in case of tumor cases or burns cases. In that conditions, these autografts will be done. So, the greater the genetic disparity between donor and recipient in the HLA system, stronger and more rapid will be the rejection reaction. It means that as there is large difference or the disparity between donor and the recipient, then there will be obviously rejection reactions will be taking place. So, if the disparity is more, the rejection reaction takes place within fast. Like today we have transplanted what some kidneys from one person to the other. So this is an allograft. So then if there is a genetic disparity between these two, it will get rejected even. Sometimes it may get rejected even in 1 month or if the genetic disparity is less, then it will be survived or then it will be there safe without any rejection reaction still some years. So so depending on this genetic disparity, whether it has to be rejected or whether it has to be accepted will be taking place. And then coming to mechanisms of graft rejection. So as I said that rejection reactions takes place. So what was the mechanisms that were involved? It involves 2 mechanisms. One is cell-mediated immune reactions and other is humoral immune reactions. So in cell-mediated immune reactions, these are mainly responsible for graft rejection and are mediated by T cells. As you know that T cells are involved in cell-mediated reactions and B cells are involved in humoral reactions. So here what will happen? Whatever the lymphocytes of the recipients are there, recipients, it will come in contact with HLA antigens of the donor. So the lymphocytes of this recipient will come in contact with HLA antigens of the donor and they become sensitized in case of incompatibility. If there is incompatibility, they will become sensitized and it will cause a rejection reaction. So whatever the sensitized cells are there, that will in the form of they will form like CD8 plus cells. CD8 plus cells are cytotoxic. That means they will directly will kill the cells which are found to be foreign particles, like foreign cells. So, and also by hypersensitivity reactions as identified by CD4 plus cells. So, because of the release of the CD8 plus and CD4 plus cells, they'll destroy the graft. This is how cell-mediated immune reactions takes place. Okay. So, first what happens, whatever the lymphocytes are there of the recipient. So, recipient's lymphocytes, once they come in contact with donors' antigens, so recipients lymphocytes, donors, HLA antigens. When they come in contact, if it was found to be incompatible, then these will become sensitized. So once these sensitized lymphocytes are there, what are the lymphocytes? T cells or B cells. So whatever the sensitized T cells are there, they will start producing CD8 plus cells and CD4 plus cells. So CD8 plus cells directly cause a cytotoxicity and will damage that graft tissue, and CD4 plus cells also by releasing of certain interleukins, it also causes the damage of graft tissue. So this is how cell-mediated immune reactions takes place. Okay, and then coming to humoral immune reactions. So in humoral reactions, what is the cells that are involved? B lymphocytes are involved. So B lymphocytes, they will be converted into plasmacytoid cells and then to plasma cells. So these plasma cells will release antibodies. Okay, antibodies or immunoglobulins. So in this mechanism, what will happen? Whatever the circulating antibodies are there, that due to pre-sensitization of the recipient before transplantation, it will causes humoral immune reactions. Example by blood transfusions, previous pregnancies, non-sensitized individuals by complement-dependent cytotoxicity, and antibody-dependent cell-mediated cytotoxicity and antigen-antibody complexes. So this is how humoral immune reactions takes place. So these are the two mechanisms of graft rejection. So one is cell-mediated and another is humoral. In cell-mediated immune reactions, CD4 plus cells and CD8 plus cells are involved. And humoral immune reactions, antibodies which are present already in the circulation, that will pre-sensitized antibodies that will cause a damage of this graft by forming antigen-antibody complexes. Okay. And then coming to types of rejection reactions. So depending on the mechanism and time period, so these rejection reactions were classified into three different types: hyperacute rejection, acute rejection, and chronic rejection. Okay. Hyperacute rejection reaction. So the name is hyperacute. That means within minute, like will happens very fast, immediately. That means the rejection appears within minutes to hours of placing the transplant and destroys it. That is called it as hyper. So here, if you see, the time period is very less. That means within minutes to hours, the rejection may takes place and destroys it. So it is mediated by preformed humoral antibody and against donor antigen. So already in our body, we'll be having some kind of antibodies, preformed antibodies. So immediately when this foreign particle, like when graft is placed, immediately whatever the preformed antibodies are there, that will directly start attacking and will damage the graft within few minutes to hours. So it is mediated by preformed humoral antibodies. Cross-matching of the donor's lymphocytes with those of the recipients before transplantation has diminished the frequency of hyperacute rejection. That means before going into transplantation, previously, like prior to that, first we have to check this cross-matching. If you consider it like blood samples, blood transfusions, so in that conditions, what we'll do? We'll collect the blood sample from the recipient and from the donor. So both of these blood samples, like near about 2 to 3 ml will be taken, and both of them will be mixed, and we'll be checking for any clots or there or not. So if it was found to be if it was found to be formation of clots, then we'll stop and will not give that donor sample to the recipient. So in the same way, it also the same way applies for other organ rejections also. So cross-matching has to be done in order to prevent the frequency or in order to regulate the frequency of these hyperacute rejection reactions. To stop these hyperacute rejection reactions, first we have to go and do this cross matching in order to prevent that. Okay. And coming to acute rejection, so the rejection rate takes place from within few days to few months of transplantation. So it is mediated by both cellular and humoral mechanisms. Acute cellular rejection is more common than acute humoral rejection. So cellular rejection is more common than humoral mechanism. And then chronic rejection reactions, like it may follow repeated attacks of acute rejection or may develop slowly or over a period of months to years ago. Like it may develop after months to years or after repeated attacks of the acute rejection. So after this, we'll be getting this chronic rejection. So in this, the mechanism which is involved is immunological or ischemic reactions. Immunological or ischemic reactions. So these patients who are suffering with, who are having this chronic rejection of renal transplant, they will be showing progressive deterioration in renal function as seen by rising serum creatinine levels. That means here the rise in serum creatinine levels will be seen progressively. That means today it is like 5, tomorrow 7, after that 8. It's like that slowly it will be gradually deterioration will be taking place in case of chronic rejection reactions. Whereas in acute and hyperacute, immediate rejection will be seen. In case of chronic rejection, progressive deterioration of this transplanted organ will be seen. So here the mechanism involved is immunological or ischemic, and in acute rejection both cellular and humoral, but more common is cellular rejection reactions. In hyperacute rejection reaction, here the B cells are the antibodies, preformed antibodies will be involved. So it is mediated by humoral. So hyperacute is humoral antibody, humoral by with the help by mechanism is humoral antibody formation. Acute rejection is by both cellular and humoral, but more common is cellular rejection. When coming to chronic rejection, here it is maybe immunological or ischemic. So this is all about the different rejection reactions. So this is a brief note on MHC complex or transplantation antigens. And I hope everybody is understood with this class, and thank you.